If you have hip pain at the back of your hip, and if, like my patients, you're worried that it could be your hip joint or maybe arthritis, and maybe you're worried about needing a hip replacement, then stay tuned because I'm going to talk about all of that in today's video. Now, a lot of my patients come in and they tell me they have hip pain. When I ask them where their pain is, they usually, in this instance, refer to the back, so sort of upper buttocks, lower back. So if we have a look at a model here, this is a pelvis and this is your lower back. So this is looking at it from the back view. A lot of my patients come in saying they have hip pain and they point to kind of the upper buttock region, lower back just to the side of the spine. I can tell you now, if that's where you're feeling pain, then it's not your hip joint. If it was your hip joint, generally speaking, you'd actually feel it more at the front of your hip. You can also get a lot of pain around the outside. Now, if you do have pain on the outside or the front of your hip, then go and check out my other hip pain video right here. But if you're feeling pain at the back of your pelvis, buttock, lower back, I'm going to talk to you all about the different areas that you might feel pain. So if we just start looking at the sort of more skeletal issues that we can get. So this is your pelvic bone. Underneath all of this muscular tissue is the sacrum. Where the two overlap, this is your sacroiliac joint. Attaching here, you have tendons. So tendons for the muscles of your lower back. This area can get quite painful in a lot of people. So this is your sacroiliac joint. This is the tendons for your erector spinae. So that's one area that you might be feeling pain. You might also be feeling pain more centrally down towards the coccyx. The chances are that's probably going to be ligaments, and we'll talk about ligaments in a minute. So joining the two bones together, you also have ligaments. So this would be called the sacrotuberous ligament. So this is the ischial tuberosity just here. This is your sitting bone. And then obviously your sacrum is just up here. And joining those two together is a big thick ligament called the sacrotuberous ligament. So if I show you now, so looking at a slightly different model of a pelvis. So again, this is looking at it from the back. This is obviously your femur here. So this is your thigh bone. This is the bony bit that you can feel just on the outside of your leg when you push your hip over to the side. If you look just here, this is the sacrotuberous ligament. So this red, a lot of this red area here would be where your sacrum is. So my sacrum would sit just there. So this is looking at it from the back. So the sacrum would sit just here, and then you've got the ligament that's joining the ischial tuberosity to the sacrum just here. So if you've had any trauma, let's say you've had a fall or a road traffic collision, then that could quite easily affect the ligaments. And again, same with the hip. So as you're looking at the hip joint, so this is the back side of the hip joint just here, deep in that joint, you have what's called the labrum that goes all the way around the joint. More externally to that is the ligaments, the joint capsule. Now, at the back of the joint, you're less likely to have a joint problem. It's more likely to occur at the front. But in cases of trauma, that's possible. So pain at the back of the hip is less likely. It's more likely to be a muscular issue. In terms of bone, it is possible that osteoporosis can lead to bone fractures. Again, if trauma has been a predisposing factor for your hip pain, then it's worth ruling out fractures or bone infections or bone pathologies. But generally speaking, your hip joint is not the joint that's affected when you feel pain at the back. What I'm going to do now is add some muscles in so you can see the muscular layers, so you can figure out exactly where your pain might be coming from. All right, so now we're looking at the same model, but with the muscles added back on. So this is still the right side. You're looking at it from the back. This muscle here is the gluteus maximus. This has been cut away, so you can see everything that's deeper to it. Now, in my previous video, my other hip pain video, we talked a lot about the gluteus minimus and medius. So that's these muscles here. A lot of people get pain sort of towards the outside or the top of this bony protuberance. But since we're talking about pain at the back, a lot of pain can come deep within the buttock. Now, as you can see here, there's a lot of hip rotators. So these are most commonly used for sort of externally rotating your thighs. So if there's any irritation within these muscles, let's say there's some spasm or inflammation or a muscle tear, then you can get quite a lot of pain through the back of the buttock. Underneath this muscle here, this is the piriformis. Underneath this here would often be the sciatic nerve. If there's any spasm or irritation of the piriformis, that can compress the sciatic nerve and cause you sciatica. If you do have sciatica, then check out my sciatic pain video just here. You would experience pain while walking, pain shooting down the back of the thigh, into the back of the knee, or even down into the foot. So any inflammation or any spasm within these muscles here can cause you pain. And then as we come further out to the side, you can see where these muscles are attaching. If I just take this away, you can see that these muscles are attaching onto this bone. So any constant irritation or tension through these muscles can cause a lot of pulling through the attachment points, and that can cause tendonitis. So that can cause inflammation, that can cause pain. There's also something called bursa, and a bursa is a fluid-filled sac. Most commonly, the main one is just on the outside of this bone here, and that helps. A bursa helps basically to allow freedom of movement between muscles. So it reduces friction between the two muscles as they slide over each other. So it's possible that you could get bursitis around here as well. So generally speaking, they are the main causes of pain when you're feeling pain at the back of the hip. So unless you've had trauma or a fall or something with serious impact, then it's unlikely going to be your hip joint. So the most common reason is going to be muscular or tendon. It is also possible you could be having some sort of ligament strain, and that could be again from a fall or some kind of impact, collision, accident, something like that. So the good thing is, generally speaking, this is quite easily treatable. Now, if you have been following any of my videos recently, you would have heard me talk about the 3 phases of pain. If you want to learn more about this, I have gone into this in a lot more detail in my free ebook, which you can download using the link in the description below. But essentially, people start with pain. So if it's come on suddenly, then you're more likely to have acute pain. So this might be pain that's 7, 8, 9, or even 10 out of 10. So during this phase, all you need to focus on is getting that pain down. Movement or ice are 2 really good ways to do this. As your pain starts to come down, so it goes from a 7 into a 6, 5, or even a 4, the pain is probably more chronic. So it's probably been there for more months or weeks, or if you've had a chronic long-standing problem, it might have been there for years. But the pain may not go any lower than a 4 or a 5 unless you go into the next phase, which is phase 2, and that's to improve your flexibility and mobility. Then once you've improved your flexibility and mobility, this could last anywhere from a few weeks to a few months. Once you've improved that, the next phase, and in my opinion the most important phase, is to build strength. So that could then take again 3 to 9 months to rebuild the strength. But once you've done that, the chances are of the pain coming back is a lot less. Anyway, what we're going to do now is go through a couple of stretches that you can do for the back of your hip, and then I'm going to go through a couple of exercises as well. So to stretch the back side of your hip, what you can do is bring one leg up on top of the other, so your ankle is off your knee, so you're not overstretching your ankle ligaments. So you put your foot just to the outside of your knee, grab your knee with both hands, and then simply just lift it up and across towards the opposite shoulder until you start to feel a stretch. Now, if you are in acute pain, or if the buttock or the whole area is very inflamed, then this could actually be quite painful. So if you are stretching, don't bring it over too far. You're not trying to push through pain. Just bring it up to the point where you start to feel a stretch, but it's not causing you pain. A little bit of discomfort is okay, but you don't want to be making anything worse. So bring that knee up and over and hold for about 30 to 60 seconds. Now you can do this as often as you like throughout the day. Just bear in mind, if you're doing this too much, it is possible that you could irritate the back of the hip. So just go up and across, hold for 30 to 60 seconds, do enough throughout the day that you feel like it's making a difference, but not so much that's going to be causing you any pain. So the next exercise we can do is called the pigeon pose, and this is a really nice stretch from yoga. If you can't kneel down on the floor though, this is probably not the best solution for you, but it doesn't matter because the one I just showed you will be absolutely fine. So don't stress if you can't get down on the floor, for example, if you're in a wheelchair. Just focus on doing the one we did before and that will be absolutely fine. So what you're going to do is come onto a padded floor, the hip that you want to stretch, bring that forward. With the other leg, take that leg back. Now, I've got my knee off the floor, so what I'm going to do is take my foot and turn so that it goes underneath my other thigh. And from there, I'm just going to drop my hips down. So I'm trying to push my hips down and back. And as I do that, I just shift my back leg further back. What you should feel is a nice stretch through the buttocks. If that is too painful or you can't quite get down as low as that, it doesn't matter. You can just reduce the distance, reduce the range, use your hands to support you. You could even put something underneath here just to prop you up, but generally speaking, you won't need to. So from here, just drop back until you feel a bit of a stretch and just hold. And over time, you can just drop yourself lower and lower. Now, if you find this is too easy, what you can do is grab your foot and bring that foot further forward. But again, that's going to just add to the rotation going through the thigh and therefore through the buttock. So if I was to show you the other way around, again, starting on all fours, take one leg back. With this foot, rotate it so that it comes through. And I would just shift this knee forward. That way I don't have to shift so far back. And so with that back leg, you're just shifting backwards until you feel a stretch. If you want to go more, you just drop that hip down and back even more. And again, if this is too easy, what you can do is grab this foot, take it further forwards, and then drop yourself back and down. So with this one, I would hold for 30 to 60 seconds. Do that maybe once or twice in a day. But again, same with the other stretch. You're not trying to push it too fast. You're not trying to push it into pain. And also, the more you do it, the more it might irritate you. So if it does start to irritate you, then just stop, take a few days off, and then try again a couple of days or a few days later. Okay, so now you've gone through a period of stretching. Let's say that could be a few weeks to maybe a couple of months, 2-3 months. Now you want to start introducing some strengthening. There's a lot of exercises that you can do for the hip because there's a lot of muscles around the area. So what I'm going to do is just show you some really basic exercises. We're going to work on some hip extension. So that's going to be mainly covering the glute maximus, a little bit of hamstring work as well. The idea behind these exercises is really just to get you introduced into working those muscles again and starting to build up a little bit of strength. So the first one we're going to do is a hip bridge. What you can do is lie down on the floor, have your knees bent and feet flat on the floor, hands down by your sides. And what you're going to do is just lift your hips. Now, when you do this, the key is not to be using your lower back. So as you are lifting your hips, imagine you're trying to push your heels down. So rather than thinking about lifting through the hips, because what's going to happen is you're going to start arching your back, think about just pushing down through the floor with your heels. So from here, I push my heels into the floor and I squeeze my glutes, so squeeze my bum. Keep abs nice and tight and try not to round your back. So as you come up, you're pushing through the heels. Pause at the top, count of 1 or 2, and then slowly back down. When you feel the ground just underneath your bum, then pause and push straight back up again. Now, if this is too easy, or once you've been doing this for a period of time, what you can then do is lift one foot off the floor. I'll show you this way around. is lift one foot off the floor and do the same thing. Lift through just this side here, pause, and then down slow. When you feel the ground, pause, and then straight back up. So for these, I would do 10 repetitions, starting with one set only. So you do your 10 and that's enough. Or if you're doing one side at a time, then do 10 and then 10. But basically both sides want to be doing 10 reps. Over time, as you feel like that's not causing you any pain or making anything worse, then add in a second set and then gradually add in a third set. You'd only want to do these once in a day and give it a day's rest in between. So at most, you're probably only going to be doing this 3 times a week. So the next exercise is going to be called a Romanian deadlift. Normally this would be done with weights. So you would start with both feet on the floor, stick your bum out like Donald Duck. That's how I always explain it to my patients. So you start, push your bum back, soft bend in the knees, and then from here, reach down and then come back up. So as you come up, you're squeezing through the glutes, through the back of the hip muscles, and then repeat. So your back is not bending, the back is staying straight, and it's all coming from the hips. So all of the movement is coming from the hips. Keep the knees nice and soft, especially if you have sciatic symptoms, because otherwise if your knees are straight, you're going to get like a nerve, like a shooting nerve type pain. So keep your bum back, come down, pause when you feel a stretch through the back of your legs, and then come back up. Now, if you feel that's too easy, you can add some weight, or if you want to progress that even more, you can do it on one leg. So one leg would be on the floor, the other leg comes back. Now think of your body and your leg as one complete line, like a seesaw. So from here, you take your leg back and you bring yourself forward. So the movement is the same, just with one leg instead of 2. And as you come up, squeeze through the glutes and down. So only go down as far as you feel comfortable. If you feel pain, then just stop. Again, I would do 10 repetitions and just the one set. If that feels okay, then the next time you come around to doing it, then you can add in a second set and then gradually build it up into a third set. If you feel like this is starting to cause you pain or irritation, then obviously give yourself a bit of a rest, wait a couple of days and then try again. If you feel like it's not making any difference to pain, then you can add in more sets, up to 3, or you could start adding some weight. But I wouldn't go higher than 10 repetitions and 3 sets. Let me tell you a quick story about one of my patients. It's a female in her 60s, and she'd been coming to me for a while with quite acute pain in her buttocks, pretty much where I've been talking to you about today. So both sides, pain in the sort of glute maximus, posterior part of the glute medius, and on palpation, the muscles are so tight. Now this lady was convinced that she needed to go and have injections. She'd seen a surgeon before for other things, and she was convinced that what she needed was some sort of nerve block. But actually what we managed to do is convince her that she needed just to get these muscles a little bit more relaxed, a little bit less tight. Because what essentially was happening was these muscles in her buttock were so tight, they were causing a lot of inflammation on where the muscles attached. So on the insertion points of the tendons. So what we did was we managed to get the tightness down through movement, some soft tissue work, so massage, and also using a lacrosse ball at home, trying to get these muscles broken down, get them softer. And after a period of about 3 to 4 weeks, the tightness in the muscles had come down so much that actually she felt so much more relief. Fast forward a couple of months, she's almost to the point now where she's minimal pain. So it's gone from a 7 or 8 out of 10 down to now a 3 or 4 out of 10. So we have gone through the movement phase, we entered into the stretch phase, and now we're just starting to lead into the strengthening phase. But I just wanted to highlight this case just because, you know, sometimes you might be feeling so down or so at your wit's end that there's nothing that you can do. But actually, if you take a step back and just think, okay, well, where am I along this phase? So this is where you need to go and get the ebook So are you in phase 1, phase 2, or phase 3? If you're in that acute phase, all you need to do is just focus on getting that pain down. As the pain comes down, move into the stretching, and then as you've improved your flexibility, then go into the strengthening phase. If you follow that process, 9 times out of 10, you're going to get a really good result. So I hope that makes sense, and I hope you can relate to that to some extent as well. The good thing is pain at the back of the buttock or back of the hip, generally speaking, is not going to be hip joint. So go through this process, everything that we've talked about in today's video, and over time, as your pain improves, I want you to let me know how you get on. So what I'd really like is for you to drop a comment in the comment section below and let me know how this process or how these exercises and stretches have helped you. So I hope that video has helped you. If it has, please let me know in the comment section below. Let me know where you are on those 3 phases. Are you in that kind of acute or in that pain phase? Are you in that stretch phase, or are you now in that strengthening phase? If you're not sure what I'm talking about, get the ebook. The link is in the description below. And until the next video, take care and I will see you soon.